Nigeria has commenced vaccination of the COVAX vaccines. The country recently took delivery of over 3.9 million doses of AstraZeneca vaccines. What next after the delivery, and how can the country achieve seamless vaccination plan? This and many more will be discussed on Sound Health today. I am Olasunbo Modupe. Welcome to the program. We begin with COVID-19 updates. Please stay tuned.
President Muhammadu Buhari, his vice, key public office officials, Presidential Task Force on COVID-19 members, and frontline health workers have received their first jabs of the AstraZeneca vaccine. According to the PTF chairman, Boss Mustafa, the exercise is to check vaccine hesitancy in the country. He urged eligible Nigerians to take the vaccines, adding that they are safe, painless, efficacious, and they offer great hope, but we must continue to observe all public health measures. Ogun State has received 50,000 doses of the AstraZeneca vaccines. Lagos State has received delivery of her batch of the vaccines, while training will commence this week, followed by vaccination next week. The National Primary Healthcare Development Agency explained that other states are expected to take delivery and commence vaccination on the 10th of March. The Lagos State Primary Healthcare Board says the COVID-19 vaccination in the state will be done in phases in line with the federal government plan. The board added that the vaccine will be conducted in 4 phases until all eligible persons are vaccinated as more vaccines become available. The category of eligible persons for Phase 1 are healthcare workers, frontline workers, workers at ports of entry, air, land and sea ports, military, COVID-19 Rapid Response Team (RRT), laboratory network, policemen, petrol station workers, contingency, other frontline workers. While Phase 2 are old people from age 50 years and above, as well as those with comorbidities aged 18 to 49 years of age. Those in states and local government areas with the highest burden of disease who misses Phase 1 and 2 are slated. Other eligible populations will be tendered as vaccines become available, and they are scheduled for the Phase 4. The Lagos State Safety Commission has sealed no fewer than 11 facilities, including event centers, lounges, and nightclubs, for contravening COVID-19 protocols and directives during a monitoring exercise carried out by the agency. The Director General of the Commission, Mr. Lanre Mojola, stated that some of the sealed event centers had previously sought permission from the agency to organize events, but the number of guests the officials met during inspection visits to the locations outnumbered what they got approval for. Till date, more than 158,000 confirmed cases, 138,000 discharges, and 1,969 deaths have been recorded in the 36 states and the Federal Capital Territory. Globally, there have been over 116.5 million confirmed cases of COVID-19, including above 2.5 million deaths reported to WHO. As of 8th of March 2021, a total of 349,398,520 vaccine doses have been administered.
It's still Sound Health on Lagos Television. My resource person is Dr. Charles Adetunji, an associate professor of microbiology and biotechnology, Edo State University, Uzaire. He is also the acting director, intellectual property and technology transfer. Welcome to Sound Health, Dr. Adetunji.
Thank you very much, ma'am. I'm very grateful.
The country has commenced vaccination. What next, and how can we achieve a smooth exercise at this time?
Yeah, first of all, let me first of all congratulate the federal government of Nigeria for its participation in the global vaccine collaboration, COVAX effort and its commitment to protecting Nigeria against this pandemic disease. It will be recalled that federal government have announced its arrival, as the moderator have said. So the arrival of this vaccine means a lot and makes a milestone for COVAX facility in kind of upsetted efforts to deliver at least 2 billion doses of COVID-19 globally by the end of 2021. Now, this is a very good initiative and a joint combined initiative of Gavi, Vaccine Alliance, WHO, and Coalition for Epidemic Preparedness Innovation and UNICEF, which form a kind of a global impact in this kind of effort. Now, as this arrival has make a historic step towards the goal to ensure equitable distribution of this COVID-19 vaccine globally. Now, what do we need to do? First of all, as we know, the arrival of this COVID-19 will enable National Primary Health Care Development Agency to commence the vaccination in Nigeria, most especially the priority group, starting from the frontline healthcare worker. So I look forward to this vaccine being made available to people that are at risk as soon as possible, so as to ensure routine immunization service for life-threatening infection which are delivered to avoid other disease outbreak. Now, the process of vaccination, we ensure vaccination with safety and effective vaccine, which is a critical Nigerian strategy to counter COVID-19 pandemic and stop transmission of this virus. So we in Nigeria have the final privilege to join the whole globe in kickstarting the immunization program, which will prioritize first people most that are risk to this infection because of their nature of duty. We in Nigeria finally have the privilege to join other countries in kickstarting the immunization program, which will prioritize first those people most that are at risk of this infection due to their exposure in line of duty as determined by available epidemiological data.
Dr. Adetunji, before we go to the priority group, the plan for vaccination, tell us more about the vaccination strategy, especially the T.E.A.C.H initiative launched by the National Primary Health Care Development Agency.
An indigenous approach that is necessary to roll out the issue of COVID-19 in Nigeria. Now, the executive director said that the country has provided a kind of e-registration link that will enable all Nigeria to register for COVID-19 themselves. So in order to obtain their pre-vaccination number and schedule date. So this program is highly essential, most especially for frontline health workers, such as people that are in the laboratory, people that are petrol station workers, strategic leaders, and most people that are found necessarily airport where we have crowded people and crowded environment. So the launching of T.E.A.C.H and electronic management of immunization data will ensure smooth rolling out of COVID-19 vaccination across the country. So what is T.E.A.C.H strategy? Let me quickly explain this acronym. It's a 5-point strategy for the vaccination implementing arm of the Federal Ministry of Health and the NPHCDA to develop that has been developed over many years of vaccination implementation experience in Nigeria. So T stands for traditional vaccination campaign approach. E stands for electronic self-registration by eligible Nigeria. A stands for assisted electronic registration of eligible Nigeria. C stands for concomitant vaccination alongside electronic registration, while H is house-to-house electronic registration. So the goal of this is to ensure that there is equity in the distribution of this vaccine and to have a kind of electronic platform that will capture all the databases of all the Nigeria so that it can be monitored. The effect or the rate of vaccination can be monitored appropriately.
Okay, let's look at the indigenous approach, the homegrown approach initiated. What are the priority groups lined up for the vaccination? Because I understand aside from the frontline health workers, there are also classification of people that will get the vaccines stage by stage.
Yeah, I'm going to answer this in phases. Uh, First of all, National Academy of Science, Engineering, and Medicine have released a kind of global guidance on communication strategy to combat mistrust and build a kind of confidence in COVID-19 vaccine based on research, decision making, changing belief and attitudes, and reaching and engaging diverse audience. Now, I'm going to use an approach called a tiered approach, which involves phase one that targeted health workers and first responders because they are the first person that's going to apply this. So they are in phase one. Phase two, and they represent 5%. Now, phase two involve people with underlying condition that put them at higher risk evidence or higher risk of severe COVID-19 disease and death, and other older adults in densely populated environments. So this group represent 10%. Now, phase three entails essential service worker at higher risk of exposure, like teachers, school staff, people in a homeless home, shelters and prison, adults that do not have that have not been treated, and people that are underlying condition, which put them at a kind of a moderate risk. So we can say this group constitutes 30 to 35%.
According to the chairman, PTF COVID-19, Boss Mustafa, the total number of the AstraZeneca vaccines that we are receiving from the COVAX facility is 84 million doses. We can vaccinate 42 million Nigerians with it, which accounts for 20% of our population. How do we achieve herd immunity?
Yeah, when the coronavirus that causes COVID-19 first started to spread, virtually nobody was immune. You must know that. Now, meeting no resistance, the virus spread across communities. So stopping will require significant percentage of people to be immune. But how can we get to this point? Now, most countries around the globe are trying to obtain a herd immunity to COVID-19 disease. Now, one of the aims of working towards the herd immunity is to keep vulnerable groups who cannot get vaccinated due to their health condition, like allergic reaction to vaccine, safe and protected from other diseases. So let me quickly say what is herd immunity. When most of the population is immune to an infectious disease, this provides indirect protection or herd immunity, which is called health protection, to those who are not immune to disease. So, for example, now, if 80% of the population is immune to the virus, 4 out of every 5 people who encounter someone with the disease won't get sick, which implies that the disease won't spread further. Now, in this way, the spread of infectious disease is kept under control. Now, depending on how contagious an infection is, usually 50 to 90% of population needs immunity to achieve a herd immunity. So we expect that people who get infected will be immune for months, or probably not the entire part of their life.
Does that mean if I have been infected with the virus, can I still get the vaccine? Is it advisable to get the vaccines? Even when
Yes. Definitely, it's very necessary to get the vaccine because the vaccine will naturally help to build a natural immunity against any infection, or that whenever the person that takes the vaccine is exposed to any. So it will stand as a barrier and build up the natural body immune system. So it's very necessary.
Public have been advised to register online. Do you think we can achieve enough success with the level of technically inclined persons in the country?
I think it's possible, it's feasible, because almost everybody have become aware there is a high level of sensitization about digital, application of digital. Like everybody use phone, Internet of a thing have come to stay, artificial intelligence and machine. So anybody that can operate a phone or that can browse on internet definitely will be able to register for this because it's necessary for tracking of disease, screening of infection, quarantine isolation of infected patients, application that I might not be able to go into because of our time.
All right.
So anybody that can use a mobile phone will definitely be able to register.
3 months after the first doses were rolled out in Europe, funding shortfalls, regulations, and cold chain requirements have slowed the process of rolling out the vaccines. What must be done differently to achieve a seamless vaccination plan in Nigeria?
Yeah, there is a need for us to have a framework for equitable allocation of COVID-19 vaccine, which over a kind of overarching framework for vaccine allocation that will assist policymakers in domestic and global health community. So, which imply that we must be cognizant of several factors like race, ethnicity, age, age group, residence, occupation, socio-economic condition, and other contributing factors. So we need to work together to ensure that everybody have a right to this vaccination, so that it will not go to some certain ethnic group, some rich or poor people, or rich people will have a better advantage than less privileged people. So there must be what I call framework for equitable allocation of COVID-19 vaccine, which will ensure equal spread of this particular exercise.
The World Health Organization says the job is not done when it comes to developing vaccines against COVID-19. In parallel, in the global rollout of vaccines, we must now redouble our research and development efforts to tackle the emerging variants of COVID-19. What's your take on this?
Yes. Thank you very much, Ma. There is a need for all the scientists all over the world to identify knowledge gaps first and set research priority for vaccine against COVID-19 disease. Now, there is a need to discuss several safety and efficacy on existing vaccine. New candidates are on the way, so we need to optimize, limit supply, and need for additional safety studies. But I must commend the efforts of all the erudite scientists around the globe, most especially for the development and approval of several safe and effective vaccines, which is currently ongoing. You can see now in Nigeria now, we already have the vaccine research. So that means that there is a need for a collaboration which has to prevail in this challenging time among stakeholders, industries, and universities. So we must be mindful of inequalities, which I've said earlier. We must be deliberate to challenges. Now, experts must agree that there is a need for critical research on how to administer vaccine in targeted population, as well as on vaccine delivery strategy and schedule. This includes trials, modeling, observation study. All of you will help to inform the policy. Also, the issue of impact of emerging COVID-19 on the efficacy of this vaccine, the impact of vaccine on transmission of infection. They need to develop next generation of vaccine platform. So, as I said earlier, improvement. There was a time there was issue of can you store at -70, -20. So in this part of the developing country that we don't have the constant electricity. So we must be able to intensify efforts on how to develop the kind of vaccine that can be adapted and adopted around several parts of the globe.
Right, thank you so much, Dr. Charles Adetunji, my resource person for today. You have been talking about the vaccine rollout plan in Nigeria. Thank you so much once again for your time.
Thank you so much for having me on this program. I'm very grateful to your reputable television.
You're welcome, sir. My resource person has been Dr. Charles Adetunji, an associate professor of microbiology and biotechnology from T.E.A.C.H University, Rosaire. He's also the acting director, intellectual property and technology transfer. Sound Health continues with trending health reports. Remember, you have the capacities to stop COVID-19. Register online for vaccination, but while you wait for the vaccine, carry on with the non-pharmaceutical measures such as hand washing with soap or sanitizer for at least 20 seconds. Wear a mask and avoid large crowds. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.